Traditional first question for you, Dr. Miller. We were actually talking about this a little bit before. I think you and I have the best philosophical, esoteric, whatever you want to call it, cancer discussions out of anybody we have on these calls. But yeah, traditional first question is always, you're one of the top cancer focused doctors in the world, Dr. Miller. What is on your mind these days when it comes to cancer? What have you been thinking about? What have you been digging into? What have you been noodling over? What did you think about in the shower this morning?
Well, I'll start with I didn't take a shower this morning. I don't shower every day, actually. It's one of those things that's it's funny because culturally we do take a lot of showers, and I've just never been one to take a shower every day. I don't know. I think there's something to like keeping the natural oils in your body. I've never been like a really smelly person either, though. So it hasn't been something that I really felt like I needed to do. Um, but
This day when we're actually on the calls is like the one day that I'm sure to take a shower. But other than that, it's hit or miss.
well, you smell great, Ryan. From here, I can tell you've been showering. Thanks. Yeah, well, when it comes to this stuff, I mean, obviously, my perspective is always kind of looking at the bigger picture about just cancer and the whole story of cancer ring, right? Like this, my idea that this is the disease of our time and that we're all dealing with cancer, we're all facing cancer, whether it's ourselves, it's our family members, friends, we're all being touched by it in myriad ways. And so I started thinking about culture and I started thinking about how we behave in the world, the things that we do, what we create, and how all those things manifest in our bodies. And this, I come from this old Taoist school of thought, right? Where you're looking at the macroscopic view, you're looking at the ecological perspective, looking at all things interconnected, cycles and seasons and things, and how they're all influencing the individual, they're influencing each other. And then seeing just how it's a mirror in many ways for what's happening inside our bodies. And so there's this ecological connectivity that I always see happening inside and outside of us. And so I can't help but always be musing about that in particular. And so the idea of rewilding is kind of one of the concepts that I've been thinking about. And it's, rewilding nature, of course. And like David Attenborough said in his kind of his expose on his life as a naturalist and looking at just what he's seen over a lifetime, right, at 97 years old. And him saying that if you take a very small area and you rewild that area, it starts to teem with life to a degree that it supports all the regions outside of it. They did this with a couple different ecosystems, a little island ecosystem over in Southeast Asia. They stopped fishing. And then before long, there were fish all around. There were fishermen surrounding this border because there was all of this abundance coming out of there, much more abundance than just to support that local area. So the idea is that if we could, get back to the wildness where there's diversity, because that's the thing is that, this whole story about civilization versus nature, and then the struggle, and then us suppressing nature and controlling it and wanting to get, then we start to remove ourselves from nature. And now we've separated the microbiota populations from us, and we've reduced biodiversity in our world around us. We've reduced the biodiversity in our bodies. And now, we're susceptible to all these different things that are here because it's the diversity of microbes, of all these different living organisms in and out of us that creates this dynamic interplay that really, to me, represents balance, naturally controlled harmony, homeostasis, all these things. And so we've just lost so much of that. So I think that's like always on my mind. That's kind of number one when it comes to cancer and how I think about it. Obviously, we're going to get into some very nuanced and fine detail as we go into this conversation. I'm sure people will ask me questions that will require a lot of very rational language and a lot of very refined scientific thought. But I like to start at this point because I think it's really where we can have the biggest influence on cancer as it relates to us as humans in the world.
Cancer has been called a lot of things when you say what is cancer, but an imbalance is certainly one of the very core foundational things that cancer is an imbalance in the body. Yeah, I'm excited to have you on, Dr. Miller. You're always a fan favorite around here. You give the Most comprehensive yet succinct, yet not that succinct because you say a whole lot, but you got just the right balance. Let us get to some questions here. This one, what do you think is the best circulating tumor DNA blood test to use after a person has completed all traditional treatments and is now cancer-free?
Yeah, I think that the question is about, how do we monitor, the presence of and today, like with the modern testing, it's called molecular residual disease, MRD. And this is where you're basically looking for bits of circulating tumor DNA or cell-free DNA that would indicate the presence of cancer outside of, whatever the primary lesion was, the place where you had originally, had the cancer, but that there's still some circulating tumor DNA in the body. And then picking up a number, basically how much of that per unit of blood, and then giving a score based on that. And I think that for me, the most effective one I've seen so far, it's well validated in the data and it's well covered now with insurance, is called Signatera, and the company is called Natera, and they also have a test called Altera, which is more of the tumor genomics information. But with the Signatera test, what generally is done is that the patient would send in a blood sample that would contain potentially some of that tumor circulating DNA, and then they would also send in some of the slides from the initial pathology or most recent pathology. Then Natera would take that in, run tests on both of those, PCR and immunohistochemistry, and then come up with matches from the blood to the tissue sample, and then be able to say, okay, here's what we're looking for. This is the stuff that's in the tumor. Here's where it is in the blood. And then from going forward, we can monitor this, at intervals, like monthly, bi-monthly, whatever it might be, and keep looking for this molecular residual disease. And so you basically get like a recurrence score. You get a score, like a Signatera score that gives you a different chance of recurrence, a percentage. Like it's pretty accurate, and it can predict, like if you basically have any of that circulating tumor DNA around after treatment, it's indicative that there's still something going on, and you still need to be vigilant and probably need to be applying, whether it's strong terrain pressures or if it's actually an anti-cancer strategy of something targeted, whether that is, but you probably need to continue with your strong pressure against the cancer if you have that molecular residual disease present. So that's my number one that I like these days.
Interesting. There was another question that popped up related about Dietary, which you mentioned that Signatera is covered by insurance, at least more and more, which is nice to hear because yeah, I know that's been a real process for a lot of those companies getting through the insurance rabbit holes and actually getting covered, which thank God they finally are. They just make so much sense. And if you're if you're gonna cover some of the things that that you're covering in the conventional cancer world, at least cover that, because it does have so many conventional therapeutic applications as well. But yeah, I heard about Dietary recently at a conference. They had a pretty impressive presentation, but pricey from what I understand. And I don't know. Do you know much about them and the differences between them and Signatera?
You know what, I've had a couple of patients do Dietary testing, and I know that's like, they go into the idea of cancer genetics, right? I'm not sure if they're doing the same kind of thing about, as far as testing, looking for molecular residual disease, in the same way. But I know that they've been doing a lot more work out there. I think they have that, is it like True Check that they have, like True Check? It's like a breast cancer screening test, for trying to detect breast cancer early. It'd be kind of like a Cologuard or something, where you're trying to pick up little bits, oftentimes like cytokeratins, proteins that are often associated with a certain type of cancer. So I think the technology is coming online, and they've got, tests for different types of cancers, prostate and everything else. But I'm not sure if that's as covered by insurance as often. I haven't seen, any oncologists ordering that test at this point. So sure.
Good enough. After completing conventional treatments for rectal cancer, including 8 chemos, 28 radiation treatments, and several surgeries, blood work suggested iron deficiency. Ferritin was 7. After taking Iron Synergy from Natura, I know that's one of your favorite brands, Dr. Miller, for 3 months, went back up to 27. Was told to take one every other day. Iron Synergy is now back ordered till April. Found something called Solgar Earth Source Food Fermented Koji Iron, 27 milligrams. Would that be good? Do you have any other comparable, acceptable substitutes to Iron Synergy? Which, yeah, it's actually a really good question because we talk a lot about, I don't want to say the dangers, but kind of the days when a conventional oncologist just says, well, just take an iron supplement when people's iron gets low. And that would not be a good idea, just taking any old iron supplement in an active cancer situation, or any situation really. Iron Synergy, I know, accounts for that, but I don't know. What's your thoughts there?
Well, I mean, the reason I like Iron Synergy and a lot of the Natura products is because of the naturized idea, right? Which is basically this, there's 3 different types of naturization that occur. And with the Iron Synergy, this one is basically feeding the iron to the lactobacillus culture, the bulgaricus culture, which is the culture that has traditionally been used to make yogurts and such. And so you're integrating the iron into this matrix of this living organism, and that's what creates this real bioavailability. And even, some of the metabolites that come out of that are even like structures of iron that we don't fully understand. We haven't been able to test them all, but likely they could have other aspects of effectiveness for increasing iron bioavailability in the body, or assimilation, or even the way that it's transported, et cetera. We're not, we don't know all those details, but generally, if we can get the nutrient into a whole food matrix, that's how we want to take it, right? And so without, I've got the same problem. Iron Synergy's been out. Natura is a smaller company, and they're extremely, they're just their integrity is very high. They're uncompromising with what they're going to do with their products. They make sure that everything is the highest quality they can get, and that the quality is really just a deep evaluation. Then we basically, I've had to find another source also. So I've gone to Innate Response. They do a whole food iron that I've been using. That's also really good. And like Ryan said, with iron, we don't just generally, like, it's like, what's the reason, right? So there's bone marrow deficiency. That's one of the reasons, like, we're just, the bone marrow is deficient, and we don't have enough iron in circulation from that, as well as there being actual just iron deficiency in the serum. There's also like blood deficiency in the terms of the more, Taoist Chinese medicine idea. That's a little bit broader concept. But in any case, we want to nourish the whole system. And that's where Iron Synergy brings in the Angelica, the Romania. It brings in the dock, burdock root. It brings things together, beet. So all the different things that are going to work with the iron to help the body recognize it and then help use it in a way that it was kind of like used in our body for millennia as we've grown up with it. So that's the kind of principle. And I'll just say, I think you mentioned something that's interesting. That was Ryan, that was around, sort of like, is iron okay to give in a cancer case? And we just talked about how do you test for cancer being potentially in the body post-treatment when you've reached a state of no evidence of disease, right? So we've done the scans, you did all your tumor markers, whatever else, and it doesn't look like there's any more cancer. So we're at no evidence of disease, right? At that point, is it okay to give a bunch of iron? Because I'll say this now, and it relates to probably a number of the questions that will come in, because it doesn't matter if it's iron, if it's copper, if it's glutamine, it's sugar, methionine. It goes on and on, the list of potential things that we could take into our bodies, B12, folic acid, right? Methyl donors, anything that starts to become something that is essential for gene replication or for angiogenesis or for the manufacture of growth factors. These are things that if they're brought into the body in abundance, where like just you're getting a large influx of that material such that the blood level goes up beyond what the body can actually use and assimilate and actually bring into your cells, into the trillions of you cells, suddenly there's a surplus of a material that is hijackable. And that's what I always think of, that any of these things can be used to hijack, energy, material resources by the cancer if it's there in abundant quantities. It's not that any one of those things is inherently bad. You have to have those things. We can't live without glutamine. We can't live without arginine. We can't live without, anything I just mentioned. So the question is how much to give, and when, and then do you give it just as an isolated supplement or as an isolated, nutrient, or how do you give it? And so one thing about iron, and this is something I learned from Donnie a long time ago, and our whole group has been doing for the last, I don't know, 30 years or so, is combining any iron that you would give to someone with cancer, whether it's, molecular residual disease or during treatment or post-treatment. If you're trying to get their iron levels up, combine it with artemisinin. And the artemisinin, the way that it works is that, this is the same mechanism that's in malaria, why it works so well as an anti-malarial and became the #1 anti-malarial drug in the world, is because it binds to iron to cause an oxidative reaction. It's a ferrous reaction that causes damage to the cell that then ends up leading to apoptosis when the damage expands. So the idea with iron is, great, give the patient that needs it some iron to support them, but also give it with some artemisinin. So it's like a Trojan horse. The cancer cells take up the iron, and then here comes the artemisinin. Boom, you've got this little explosion happening in the cancer cells. And it's very unique to like malarial cells, spirochetes, Lyme disease, Bartonella, Babesia, things of that nature, and cancers too. It doesn't seem to damage human cells. Even with Artemisia annua, there's no toxicity to the human cells. That's really an incredible thing about that plant and about artemisinin itself. And so I want to say one more thing is that lactoferrin is an interesting molecule too. That's an iron transport. It's like it helps with the absorption and mobility of iron in the body. And sometimes you need a little extra lactoferrin to help people get iron into the system and help to build that iron level. So you've also got bone broth, bringing in broths, and then you've got the herbs. Like my classic formula for the iron deficiency is the main erythropoietin stimulating formula called Angelica decoction to build the blood. It's a Chinese medicine formula, Dang Gui Bu Shui Tong. 1247, Li Dongyuan built this formula, 5 parts to 1 part. Really amazing how the research shows that it increases erythropoietin levels, increases red blood cells. And again, it's not going to be driving cancer growth. These plants that can help the body build things, they're not driving, astragalus does not cause cancer. Astragalus does not promote cancer. This is an adaptogenic plant that out of all the things in the world, it is exceptionally geared to work with our body to support immune function. It enhances so many aspects of the immune system. Anyway, I just wanted to say that when you're thinking about iron, especially in the context of cancer, especially in the context of, wow, I sure wouldn't want to give my body a whole bunch of something that my body can't use all of it. Now there's a surplus. And then the cancer is like, oh, there's a lot of iron coming in. I guess we'll start using that. And we're going to use that because iron is required for gene replication. So you have to have iron in order to work as a substrate for gene replication. It's like the magnetic quality of it. So, it's just something to think about when you're looking at iron supplementation. This is kind of like the basic overview on how I would think of it in cancer.
Thank you, Dr. Miller. And while you were talking there, I remembered the other piece of housekeeping that I forgot. Guess what it is? Your bio. Dr. Jason Miller is the owner and founder of Jade Mountain Medicine Incorporated in Ashland, Oregon, where he specializes in the collaborative management of patients with cancer and chronic disease. His exploration of the role of botanical and nutritional medicine in oncology began with the relationship with Donald Yance. Just had him on one of our past Going Integrative Plus calls for the first time, and he is indeed a genius, as you mentioned there. Dr. Miller, founder of Natura Health Products and the Dietary Center in Ashland, Oregon. Soon after graduating from Oregon College of Oriental Medicine in 2005, he began working directly with hundreds of cancer patients in desperate need of support and guidance through the maze of challenging decisions that a cancer diagnosis brings. His approach bridges ecological principles of traditional Chinese medicine with modern biomedical science and research to create an integrated framework for deepening our understanding of human physiology. His goal is to help people find ways to overcome cancer or chronic disease, to help them live happier, healthier lives, and to turn complex medical concepts into easily accessible information, which you do a great job of. He also offers consultations and patient care services for people with cancer and chronic disease and for the practitioners who support them. I like it. And this is actually a good follow-up to the iron question along the same lines of things that might feed cancer or not be wise in a cancer situation. Transitional urethral kidney cancer in 2016, Keytruda in 2017, went into remission until 2022, recurred in spinal tumor, radiation, then Keytruda in remission as of January 23. My question is, what supplements or alternative, integrative, so on and so forth, cancer treatments should I be avoiding to keep cancer at bay?
Well, my first like kind of red flag is alternative cancer treatments, right? So it's like there's just medicine, and this is the thing I always want to say. It's all every tool that we've created may possibly be helpful for someone. You know, I think there's some things that probably they're just not that helpful for a lot of people. But I do think that the tools that we have available can be looked at in a huge, wide kind of pyramid of possibilities. And I don't want to think of anything as being alternative. And if somebody's promoting alternative treatments, it's just, you know, we have this long sort of standing battle between the alternative and then the standard of care. And it's like, I don't want to promote that. It's not helpful. Some people need a combination of therapies. You know, my whole philosophy is collaborative. How do we work together to create the best solutions? And most of what I do building my recommendations documents for people is I come up with a way to integrate what I am, you know, doing and bringing with what they're doing already from oncology, if they're already, you know, invested that way. And then, of course, how do we look deeper and how do we find more information that might help to target things better down the road? And that's a big part of it also. But it's really about collaborative, you know, medicine working together. And so what kind of alternative cancer treatments should I avoid? I would say that just don't rely on any one thing based on someone's anecdotal case. You know, I mean, soursop tea is not going to cure your cancer. You know, Hoxie is not going to cure your cancer. You know, you can't just do the Budwig diet and you're going to cure your cancer. You can't just go down and, you know, it's like neoplastons with Brzezinski. Hey, you know, for some people they've worked. I've also watched people go there and die. You know, it's just, you know, you have to be really careful what you choose to do. And I think with anything, you know, the choice that you make should be well-founded in some, you know, something that resonates really strongly with you. Like, this is my choice. I think it's really, you know, this means a lot to me. It makes sense to me. And then reflect on it with others, right? And also I'll say that there's a big push from the people surrounding the individual with cancer. They have a lot of ideas. They have a lot of, you know, they're grabbing onto things. They're saying, oh, look at this. You got to do this thing. Oh, you have to do this. And a lot of times it's, you've got to do, you know, whatever the standard of care is. But in some cases, the standard of care just isn't, it's not good enough. And I mean, I'm saying that because, like, for example, I just had a guy with a newly diagnosed gastroesophageal carcinoma, you know, and it's poorly differentiated. And, you know, on diagnosis, he's stage 3 with, you know, a pretty hot lymph node, local regionally. You know, the 5-year survival for that cancer was standard of care. And that means, you know, doing chemotherapy, potentially immunotherapy, radiation and surgery is, you know, it's really low. You know, it's down like 10%, 7%. And then the other thing is that at that point, you know, what happens, the sequelae of that treatment is extremely debilitating. You know, the first thing I told this man is, we're going to get you a J tube or a G tube today, like tomorrow. Like, I called my friend as a surgeon, like, hey, can we get this guy in to just get into his body what he needs, medicine? Because the thing about these cancers in the esophageal region is that they're always, you know, you get this block of the actual ability to take in food. It's painful and it's blocked, and it's like a really hard place to have cancer. And then you start radiating this area, you start surgically removing things, and the damage, the scarring, and oh man, it's really intense. Even if you do survive, if you're in that small percentage that make it out some years, the sequelae, the long, going back to the hospital, the procedures. I've just been down that road a lot. So, I'm saying that the reason I want to bring this up is because it's not about alternative treatments. It's about what's the right treatment for me or for this person. And really the tools are, how do we determine that? What guides me to a certain treatment, right? And it might be that, you're just like, man, I'm just convinced, Jason Williams down in Mexico City is going to, this whole idea of injecting, immunotherapies into the tumor rather than putting them systemically and potentially doing ablation. Maybe that's the thing that you're really drawn to. Well, I mean, it's worth exploring that, but it's, a lot of these things have big out-of-pocket costs. So you've got to think about that too, and think about, it's like, what are the resources that we have available, right? But the main point is, don't go and say, okay, I've got stage 4 breast cancer, and I just, my oncologist is not offering me a cure. It's just going to be more chemo and the next targeted agent. So I don't want to do that. So I'm going to do high doses of THC. Well, I mean, I've watched that happen. I've watched people do that against my, recommendations. And I've never seen it work like these anecdotal cases. There's always anecdotal cases. There's anecdotal cases of people doing nothing and their cancers go away. You know what I'm saying? Like, things happen in this world that are not explicable in the simple terms that we're used to. And it doesn't mean that if, 10 people who survived and said, oh my gosh, I did this treatment and I survived, there might have been 10,000 people that did that treatment and they died and they're not talking about it.
Not hearing from the ones who, it didn't work for.
Exactly. So just be really, really careful about what you hear out there. Don't think Laetrile is going to cure your cancer. You're not going to eat some kernels from, apricots, and cure your cancer, B17. It just doesn't work like that. And so we just have to do good work. You analyze the terrain, you observe, you apply materials, you observe, you gather genetic information, tumor genomics information, you apply therapies, you observe, you combine things, and that's how we come up with a plan that works for people. And sometimes, like I said before, the cost of cure is too high. It's too high. I've watched a lot of people over years and years do so really well, but get to a point of like, I just need to get this thing out of my body. I'm going to go for this thing. It's a bone marrow transplant. It's a CAR T treatment. It's a, whatever it be. It's a vaccine. It's something. And it's a surgery. But once it happens, everything has changed from that point on. And whatever stability we had generated over the past 5, 10, 15 years suddenly is thrown out the window. And if it didn't work, if you weren't that one of those cases that had the amazing result, now you're on this other course. And it's very hard to get back to that stability that we had created. And there's a little story about the tumor microenvironment, which is a concept that a lot of people don't really understand, that the tumor microenvironment, TME, it's this living complex. It's made up of all kinds of different cells. And of course, the bulk of those cells are, the cancer cells, which are originally from, one of our bodies that have enough mutations in the tumor suppressor or proto-onco or oncogenes, the drivers, the accelerator genes, or the brakes genes. Either the brakes are shut off or the accelerators pressed too far because the mutations built up to that point. Now that's the majority of these cells, but there's fibroblasts, there's neutrophils, there's platelets, there's macrophages, and these are all tumor-associated cells that are inside the tumor microenvironment working to build it. And it has all this network of fibrous material. It's got all kinds of layers to it. It's very, very, it's like its own little ecosystem world, like a biosphere inside our bodies. And it is woven with our bodies. Nerves are going into it, blood vessels are going into it, our bodies in and out of it. So this becomes a very strong, well-established relationship between the body and this thing. So anytime we're going to intervene at a level that we're going to break that weave, we need to consider, what is that doing? How does that influence the stability, whatever that might be? And sometimes it doesn't matter, because if the thing is so powerful and out of control, it's just growing like crazy. Well, we need to get information. We might have to get in there, whatever it might be. But it's just, again, just be careful, be thoughtful, be careful with your decisions, and don't put all your cards in one basket, don't put all your eggs in one basket. find lots of solutions. And it's just, there's no silver bullet. There's never going to be. It's not that. That's why my original plan, what I said, what I'm thinking about is, how do we not get cancer? How do we change this cancering thing? Because the war against cancer is not a war we're going to win. It's not a war we can win.
Yep, and that is exactly why we created this this program, Going Integrative Plus, because I spent I don't know how many hundreds, probably thousands of hours, devouring all of the alternative cancer information I could. And I'm not saying that that was a bad thing, because I have a very wide base of knowledge now when it comes to all things holistic, I'll say, the holistic approaches to cancer. But yeah, I mean, if you just go down the list of, like you said, Budwig and Hoxie and, all the storied, quote unquote, alternative cancer, therapies out there. One, there's no way you can do them all at the same time anyway. And two, it's nothing saying that they're actually going to work. And yeah, after all the studying and, all that stuff, it was only when I started consulting with, great minds like you. And when we found our original naturopathic oncologist, Dr. Paul Anderson, and I could just ask him, hey, what do you think about this? I'd get a much better informed answer than, dozens of hours on the internet trying to read up on this stuff, which of course now the internet is completely ruined anyway, and you can't even find any good, juicy alternative cancer stuff. So it's like the opposite problem we have these days. But yeah, good stuff. This question, Crystal's question, kind of combines I'm seeing a lot of two different themes, and this kind of combines both of them. The question itself is so many opinions on diet to prevent cancer, active cancer, and post-cancer. Our son relapsed from leukemia, ALL, had a bone marrow transplant. He was 17 when he was diagnosed, now 23. 2 years post bone marrow transplant would be March 2024. In an effort to prevent relapse and stay that way, what should his diet look like? Meat, no meat, mostly veggies and fruit. It's also very confusing. So yeah, there's a lot of questions on blood cancer in particular, Dr. Miller, in terms of, how do you look at a blood cancer differently, or do you look at a blood cancer? I mean, of course, you look at every patient differently, but in terms of the broad strokes, how do you look at a blood cancer differently than a solid tumor cancer? And then yeah, also a ton of questions on the guest side, in particular on diet. Is there one cancer diet that is the cancer diet for everybody, or is it individualized? And if it is individualized, how do you figure out what's best for you? So on and so forth. So yeah, two kind of a two-part question there, I suppose.
It sounds like we could just get out some slides and have a lecture here to kind of
You could probably spend the next hour and 40, an hour and a quarter on that question alone, but yeah.
I definitely could, because there's just so much, and we try to do the, what's like, you're always looking for the data, right? What's the best data? Like, did we study this diet in a lot of people that have cancer? And did we see the outcomes against a group of people that did a different diet? Were we able to compare those? Well, we don't have a lot of that stuff. We have epidemiological studies that look back at what people did or didn't do in the past based on surveys, right? And then we look at their outcomes based on that information, and we kind of come up with theories about it. But it's not like there's a hard science about it. I think that the stuff that's important is around, like I was saying before, with blood sugar, for example, all the data on, high insulin levels, high blood sugar levels, high IGF levels, low IGF binding protein 3 levels, all the things that relate to insulin resistance show that people have a higher risk of cancer. And we know that cancer generally is pretty glycolytic. It definitely likes to take sugar, quickly convert it into pyruvate and make lactic acid as a byproduct, right? So it generates this rapid energy. And part of the theory about that is that the reason that cancer selects that approach is to make sure that it has plenty of other materials that it would normally use to run the Krebs cycle to be able to preserve its growth, deeper, bigger growth, structural growth. There's like, the Warburg effect and then the reverse Warburg effect. This is a deep kind of study. And so thinking about that as a way to think, okay, well, mechanistically, how do we, just make sure that blood sugar and insulin levels are not high so that cancer starts hijacking that resource. Again, if there's a lot of something around, generally cancer will find a way to use it, okay? Especially if there's a way too much of it. So just basically making sure that you're not, spiking blood sugar levels. That's very basic, but I think it's important because it doesn't matter which diet it is, that's important. The other big diet that people keep harping on is ketogenic, right? And ketogenic has applications, right? This is the idea that you're eating mostly fats, you're eating lots of vegetables, and you're eating, meat proteins or dairy, things like that, to basically not get in carbohydrates, get a very low intake of carbohydrates so that you enter this state of ketosis, right? Ketosis being, this certain level of ketones. Not into ketoacidosis, where you have ketones generated by too much sugar, that's diabetes, but ketosis, where you're in this kind of optimal zone where your body has shifted towards a ketone fatty acid related energy metabolism, favoring that over just glucose. And the idea is that you're not having as much glucose available for the cancer cells. And that's good. It has some benefits and it's helpful in some cases. I generally only reserve that as like a strategy, like straight ahead keto, for certain cases, especially glioblastomas, cancers of the brain. It tends to be, it's a very high fatty acid and it's a very high glucose uptake in the brain. And there's just been, I've seen the best data in that cancer and also the best results clinically, because cancer is really adaptable. And even in GBM, there's some studies showing that it'll adapt over time. If you just shift to a fatty acid metabolism and, you just like run that system for a long time, cancer will say, okay, what's the resource? Well, the sugar's gone away. Well, let's try to use this. If you remember Jane McClellan, she's got that Metro map that she created, right? That had like the glutamine, glucose, and fatty acids, right? And she broke it all out into this triangle about this. And cancer just hijacks all those pathways. And they're all, it doesn't matter. Again, it's about adaptation for resources. And so we get back to this dietary thing. A lot of it for me comes back to what's the health of the patient? What's the status of their bone marrow? The marrow, like, looking at you can look at the formed elements in their body. You can look at other certain markers, just making sure that they're not taking in things that are triggering to inflammatory cycles, keeping them out of a histamine generating state, a hypersensitivity state, making sure that you're not inflaming the system. And sometimes I'll just do simple things with people if I really want to be like in a tight diet, not in terms of meat or no meat. I don't think that that's the big issue. I think that we've had this long ongoing debate about what's better, vegetarian, meat, now there's veganism and then there's carnivore diet. It's like, well, where are we going? That's not the point. Really isn't about one or the other. It's not. It's about what works for people. And of course, there's a spiritual aspect to it too. Some people don't want to eat meat. And I've also seen a lot of those people who decided not to eat meat for spiritual reasons did suffer physically when they could have used some more, nourishing sources, especially because our soils are so depleted, right? Our environment has been damaged heavily by our approach to agriculture and to animal husbandry and everything. So I just want to say that. And so getting back to this idea of inflammation, coagulation, histamine, instability, the thromboxanes and leukotrienes, all the things that get generated through this inflammatory process. We don't want that to happen. When you're in this state of remission, we want a durable remission. So let's keep the system cool, keep it cooled down. And one way to do that is just pulling out things, is just zero sugar, don't add sugar to anything. Don't, that means like honey and maple syrup and all that stuff. Just don't eat sweet things, just keep it simple. Remember, eating sweet makes us bitter. Eating bitter makes us sweet. This is old Taoist wisdom. It has a lot of value today. So just that's a really simple thing to take in. But then it's also like for some people, wheat is an issue. Gluten, it's a real thing, right? It's not for everyone, but you can quickly observe whether that's a problem for someone or not. And it can be IgE, IgG testing. You can muscle test. You can do elimination diets. Elimination diets are a great way to figure out what people are sensitive to. But then you've got dairy and corn and soy, you've got oats and nuts and seeds and chips and popcorn and caffeine and cocoa and alcohol and nicotine and cannabis and all the other things that people like to do, that you basically just say, you know what, let's just not do things that could inflame the system. And for a while, just kind of keep it stable. And so it's, for me, the basic diet, every diet for me basically is plant-based. All it means is that you're eating a lot of vegetables. And of course, if someone has a sulfur sensitivity, they can't eat a lot of these different, cruciferous vegetables, things that are rich in sulfur. So you have to keep that in mind. If people are really sensitive to oxalates because their microbiota population has been damaged, yeah, then you should be, to take it easy on the oxalates for a while. But the idea is just to keep the system calm, eat lots of vegetables, eat good, clean proteins, and eat good, clean fats. Olive oil, amazing. Oleorubin, oleic acid, squalane, so many wonderful compounds that are, cancer inhibiting through many different pathways. And, people who are on HER2, medications, HER2 targeting, I mean, it's the thing. It turns on the PTEN gene. PTEN is involved in so many different connective oncogene relationships as a tumor suppressor gene. You can upregulate it with olive oil. So just, it's a great fat. I love sesame oil, and some of the nut butters are really good sources of protein and fats. Macadamia nuts can be a really good thing. If people tolerate nuts well, they're very, very fatty, one of the fattiest nuts, right? So not a lot of sugar, not a lot of protein that people react to. And then I also really like, avocados. I like coconut. I like coconut cream. I like, this kind of stuff. People can do MCT if they're more sensitive, but good fats in the diet, and even animal fats. And I like animal, proteins. I was vegetarian for 15 years and I went vegan for 3 years in the middle of it. I was terribly unhealthy at that time. I got into a lot of pain. I didn't do what you have to do if you're going to take on that type of a diet, which is focus on getting nutrition. Really, you really have to take it on and work hard at it. It's harder. I'm not saying not to do it or you shouldn't do it at all. I'm just saying that it takes more life force, focus, dedication to get enough. And if you're going through cancer treatment, or if you've been through cancer treatment, it's even harder to get enough because you've just been so heavily depleted. I always find that bone broth is like really a wonderful stabilizing food. And just to backpedal, when it comes to animal proteins, animal fats, animal products, I'm diligent about the sourcing. I like to get local. I want to know the people who grew it if I can. Yeah, I'm Portlandia. I want to know the name of the chicken, whatever. I'm just saying, I want to know that it didn't come from a caged feeding lot and somebody injected it with, antibiotics and hormones and, like strapped it down and fed it stuff like, veal, I can't do that kind of stuff. Like, I want to know that the animal had a life filled with eating live foods. If your chickens are coming from a place where they're out in the field, they're eating grubs and they're eating worms, they're eating seeds and plants, great. It's going to be so much healthier for you as a food. And then when the life is taken, it should be done with humane practices, and things now have humane as a symbol on the package. But I think all that stuff, like the China study, the meat stuff, it's not meat. We've been eating meat on planet Earth for as long as we've been here. Everything eats everything. That's not where cancer is coming from. That's not the source of cancer. I am 100% sure of that. So just not to go too deep into this, because we can get into methionine and we can get into, these, anyway, layers and layers of diet. There's lots of different ways, we can analyze the carnivore diet, all that. But I think that just whole foods, lots of plants, drink vinegar. Who was it? Was it Michael Pollan? Lay on the floor, eat vinegar, drink vinegar. Yeah, eat vegetables, not too much. But yeah, don't eat too much. That's another thing, right? Just, always in the old Taoist philosophy was eat till you're 2/3 full. Don't over.
Yep,
So,
that's a big one. If you're if all of your bodily energy is going towards digesting, then it's not going towards healing. No, that was awesome.
And polyphenols, but bathe your body in polyphenols, which are, the flavonoids, right? Those are the things that give the colors and the flavors to all these vegetables that we love, all the things that we love, the different colors, eat for color. That's really important too. The colors actually are like, healing molecules in those foods. So
we always look for high polyphenol olive oil on that note.
Yeah, it's hard to get the right olive oil. You got to really look hard.
Yeah, you got to. That's an hour-long discussion right there.
Yeah,
finding a good olive oil. But yeah, no, that was great, Dr. Miller. Yeah, there is no, there's no Yeah, I'm not going to add anything to what you said there, but it was a
Sure
very
you
very good
could.
answer to a very big question. I think you did. I think you did it justice. Couple questions on, we talked about iron and the avoidance of iron, so on and so forth, and I think you touched on this, but several questions on building the strategies to build white blood cells after treatment.
Well, white blood cells, in Chinese medicine are considered to be qi. They're the qi, whereas red blood cells are considered to be blood, that bigger blood concept that you would want to nourish blood. And then the platelets are more essence. So those are like three of the kind of fundamental substances. So when you're thinking about white blood cells and tonifying qi, the herbs that you start thinking about are, like astragalus, ginseng, American ginseng, atractylodes, licorice. There's a bunch of great herbs that start to tonify qi. And there's also, if you've gone through therapy and you're really depleted, that same formula I mentioned before for red blood cells does great with white blood cells too. That's the Dongui Bushui Tong. And that can be got, you can get that as a tea pill, capsule. You can get, I like to cook it in bulk. I have the herbs in the clinic. We buy them in bulk. We make up formulas and send them out to people and tailor them. And then people cook them and you drink the decoction that, it's really the most potent way to do it. So I would still do that, but with the white blood cells, I would just add more qi tonics to it. The other thing you can do too with white blood cells especially is you can use moxibustion, which is applying heat. And normally we'd use like a pole. You can get moxibustion poles. You get the heat, you get the end of it red hot. And there's 4 primary points, just to make it simple here. Large intestine 10, that's Shou San Li, that's right here on the elbow. And then there's Zhu San Li, stomach 36 on the lower leg. And you apply the heat. You can do a number of things. You can do, clockwise circles. You can do kind of like direct down into it, pushing the heat in. It gets really hot, pull it back out again, it gets hot. And do that for, 5-10 minutes twice a day. That will increase natural killer cell activity, improve lymphocyte counts. It's actually, there's some good data there that to support that. I would definitely make sure you're doing, some of the very nourishing materials too. Bone broth is really good. Echinacea, I really like. It's a tonic. It's really a tonic. Echinacea is a qi tonic. That's how it works. It's not a like, oh, I got a cold, take echinacea. That's a misconception. It should be taken preventatively, build the immune system, and it's so strong that you can actually increase natural killer and T lymphocyte activity to the point where you can actually abort a fetus with that plant if you took enough of it. It's also one of the most powerful anti-leukemic agents that we have in the botanical medicine toolbox, echinacea. There was a lot of great animal research done in that regard, and there's a lot of great use for that plant. But cat's claw, uno de gato, it's another one that's really good for that as well. And then the mushroom extracts, I like to do those too. A lot of those are qi tonics, especially the Ganoderma lucidum, reishi. You can also do the turkey tail. That's another one that's really good. And then cordyceps. Those would be my kind of top ones to support, build white blood cells, do all that together. If you do all that, you should see, a lot of improvement. And if people have pain with it too, and they're trying to build the white blood cells, be careful with the opiates, because the opiates, most of them are pretty immune suppressive. They inhibit immune function generation. And remember that the immune system runs on the energy systems that our body runs on. So it takes up a lot of ATP. It's a lot of mitochondria. That's again, back to that qi idea. I have a whole, presentation lecture on the way that we take the mitochondria, ATP, and then the concept of qi as a phenomenon of what's the motivating force, the force to do work in the human body. So that's just like this whole kind of way that I see the bridging of the worlds. So anything you can do, ATP support as well is really important for the immune system also. So that's kind of in the short answer. I think that's where I'd want to go. Always you can tailor it. And just to say, I'm not a big fan of Neulasta and Neupogen. There are times when those drugs are useful and effective, but over the last 20 years, we've watched it go from, oh, we have Neupogen, the short acting thing you can give them right after the chemotherapy. It'll build their white blood cell count, kind of push those stem cells to become white blood cells, neutrophils specifically. And then it's like, okay, cool, you're preventing bacterial infections. It's a good thing. Then Neupogen shots 4 days in a row. Then we built this new drug, Neulasta, which is this, this PEG filgrastim. Filgrastim is the the original one, but the pegfilgrastim is pegylated, so it gives you this longer lasting effect where it's pushing your bone marrow to make more neutrophils, over time. And then the problem is that your bone marrow is depleted. You're asking it to do this specific thing. And even though the neutrophils are really helpful for preventing bacterial infection, one of the most important prognostic indicators we have for outcomes in cancer is called the neutrophil to lymphocyte ratio. And it's the ratio of neutrophils in your blood to lymphocytes. And this is in your CBC, your complete blood count, with the differential. The pathologist looks and counts the numbers of cells and gives an absolute number and then a percentage. So you want that number to be between 3 to 1 and 1 to 1 in that realm. You don't want it to be at 14 to 1, which is often is when you take the drugs that promote white blood cells. So you just want to, again, and it used to be that you wouldn't get those drugs until you had a white blood cell count below 2.5, or an absolute neutrophil count below 800. But now it's just standard care. Boom, just get them every time. And just, I'm not here to bag on oncology. I work with oncologists. I love the whole, people they're working to help people, but there's money behind all of this, and they're hugely expensive shots. And now the hospitals are just giving them out all the time. And I don't like what I see when that's happening. So.
Nope. Yeah. We were, we were the combative, not patients, I guess, but caregivers of the patient. And, they were, of course, like you said, trying to push the Neupogen. And, it took me 5 minutes to find a study saying that, GCSF, the granulocyte colony stimulating factor, is that it? Yeah. Aggravates active neuroblastoma cells, which was what our son had, neuroblastoma. And I brought it to them, and they kind of smirked and said, wait, I knew you would find that study. It's like, well, if there's a study like that, why, and you knew about it, you're not going to tell me. Yeah.
Policy, man, policy. There's a lot of policy decisions made based on policy rather than being made on, what's the intricate nuance of this situation, and that's just, it's unfortunate, and it's nobody's fault. It's our fault. It's so funny too, because there's this fight, alternative. I don't like oncology. And I'm like, oh man, like the whole Pono thing, back to the Polynesians, is this, it's like, just take responsibility, all of us, for where we are as a whole. It's a hard thing to do. We always want to blame someone. We want to blame something, but it's much bigger. It's much more helpful if we all take responsibility and realize we all got here together. And let's start from that place. And then where does the conversation go with that in your heart? That's something I'm working on every day.
Yeah, no, I thought even, you can point to the bad guys at the top, whatever you want to think of that as, but we collectively created the bad guys and enabled the bad guys, it's, good kind of related question. What natural herbs, spices, so on and so forth? You can go a couple different directions with this answer. Block histamine reactions, since I understand that histamines can further activate cancer to spread. What's your thoughts there, Dr. Miller? I'm dealing with later stage double ovarian cancer with a venous stasis reaction, which I've heard may be a histamine response. Yeah. What are your thoughts on histamines and cancer? And then I don't know if you have any thoughts on whether this venous stasis reaction might be histamine related or something else, or I don't know.
When you say venous stasis, is that like you don't have a DVT? You've just got like, is it, I don't know, maybe you can clarify, just venous stasis reaction. Is it like spasticity in the blood vessels, like creating a blockage, or some like intermittent type of blood flow? I'm curious what you mean by that. I can kind of guess, but
why don't you start on the just histamine?
Yeah, on the histamine part of it. Histamine is another one of those things. It's like, it has a really important role to play in the body. We need it, but at the same time, it can really easily get, over promoted, and it's cyclical. It's just like all the inflammatory signaling systems. They tend to be cascading in order to be able to meet any kind of, some kind of pressure from the outside, right? Something that might kill us or something. We have to build this strong response. And so it keeps building and it builds on itself. It's a natural, I should say it's life preserving effect or life-preserving cyclical reactivity. And so turning it off can be a little bit hard. And I think it's important to turn this stuff off, especially with the histamine issues. And in a kind of like a situation that you're describing, you said double ovarian cancer, which I assume means you had initially treated with, probably Taxol, platinum drug, and then surgical resection, or vice versa, and then had a recurrence, and then you're treated again with another regimen. If that's the case, then I don't know if you're going to do another chemotherapy regimen or not, but controlling histamine with the diet, doing kind of an antihistamine diet, is really a good thing to think about. There's diamine oxidase, DAO, which is available, and that's blocks histamine in the digestive tract. So if you're sensitive to things in the diet that you're going to eat, you can take the DAO capsules beforehand, and that will actually help to quell the histamine reaction in the GI tract. Quercetin is a really powerful antihistamine from the natural medicine toolbox. I like to combine it with nettles. You get nettles in there with quercetin, a little vitamin C, all that together is a nice complex to stabilize mast cells. Like in Jane McClellan's book also, she talks about loratadine, specifically that's Claritin. You can get it over the counter, you can get it as a prescription, like 10 milligrams twice a day. It can be a nice way to quell histamine. Mast cell activation syndrome is a big, syndrome that's showing up a lot. A lot of times people use multiple layers. Things like ketadafin, cromolyn sodium, they're very powerful stabilizing agents. PEA, palmitoyl ethanolamide, is a really good one, 400 milligrams, BID or TID. CBD is another antihistamine that you can use too. That's, you can increase the dose a little higher. But if you're doing cancer care, if you're actually getting treatment with, oncological agents, then if they're DNA damaging things, like let's say it's a platinum drug and a taxane, they're going to be damaging the cancer cells and creating the breakdown of those cells really rapidly. When that happens, histamine sometimes gets involved in supporting this process of macropinocytosis, which is where the cancer kind of like re-engulfs the surviving cells, re-engulf parts of the damaged cells. So kind of like capturing some of that stuff and being able to reuse it. There's also the nucleoside salvage side of that, and that's where dipyridamole works. Dipyridamole is another one of these drugs that's been repurposed for oncology uses to try to inhibit the nucleoside salvage. So it's kind of like the histamine issue in general. It can be a nice place to turn down this hyperreactivity in the system, and then it can also be used to kind of make some synergistic effects happen with the treatment that you might be doing as well.
Very good. And yeah, Sherry actually is dealing with it all naturally, in her words, and the edema and legs with aggressive skin bark-like rash from feet to knees is, I guess, the description of the venous stasis. Yeah.
Oh, actually, and I would say that what you need to do in that a skin bark-like rash, is there, especially if it's like purple in color, that can be, a lot of blood stagnation is kind of like one of the things that you want to work with. And so the agents that would break that up, are going to be things like Salvia miltiorhiza is a really great plant. You can get that like as just straight Dan Shen. There's like MCS formulas in the Netherlands has a nice just straight capsule. You can use it as a whole herb, but Dan Shen, it's even used as a single. Dan Shen Yin is a traditional formula, just that herb alone. Really nice for the blood vessels. It has these tanchinones in it and cryptotanchinones that regulate blood flow. You could use Noto ginseng. It's another one that's really good in there it breaks up blood stagnation to stop bleeding. And so it's interesting because the idea is that the bleeding kind of is an extravasation that's occurring around the blood vessels due to the stasis. Topically, you may even try something like the cabbage, cabbage poultice, where you like crush up cabbage leaves and just like lay them over there and put heat on it. You could do that with a little bit of castor oil too. Put some castor oil on and then the cabbage leaves. Good for the lymph system, good for helping flow and fluid metabolism in the lower part of the body. Those are all possibilities also. And I don't know if that rash, like I said, if there's more purple color, it's got more stagnation in it. If it's got more redness, it's got more heat, so you want to do more cooling. If the rash is more dry, you've got to do some moistening and nourishing in there. Angelica sinensis is a good one. It nourishes the blood and moves the blood. Those are some of those things. I mentioned dipyridamole. It may be something that could be helpful for you there too. It inhibits some platelet aggregation. And then there's also the the sort of like vascular tonics or vascular astringents, things like butcher's broom, What am I thinking of? Gotucola, Centella asiatica is a good one in that realm. Collinsonia root, also really good to strengthen the vasculature. And then I do also, berries are really good too, as far as if there's oxidative stuff in there. But those, again, with a case like that, I'd want to get a lot of specifics. I'm trying to just throw it out there. I'm like, oh my gosh, I want to help this person who's suffering, but then I'm like, really like, I should really be able to see the rash and get the case and then give the right thing. Maybe enzymes, nattokinase, lumbrokinase, those things to eat up if there's fibrosis in there, anyway, those are the thoughts.
Call this another effect question. Side effect, real, it's an effect. Anyway, I can reduce lymphedema. I was 128, 132 pounds prior to surgery in November to remove nodes pushing on the uterus, causing hydronephrosis, affecting my kidney function. Fluid is increasing since, going on Elahir, monoclonal antibody infusions. I now weigh 160, which is all fluid from the waist down into my feet. None of my clothes fit, and I can't walk or go upstairs. Don't think my skin can stretch much further. Yeah, lymphedema. So yeah, I guess it's post lymph node removal, and then also post monoclonal antibodies.
Edema sounds like a lot of lymphedema, right? Yeah.
Yeah.
Okay, so interesting. So you did the monoclonal antibody, you did the lymph resection, and post those treatments, you've had this really severe lymphedema in the lower part of the body. That's what it sounds like.
Indeed.
So, all right. So in that case, it's tough. And there's some lymphagogues that we need to work with in the kind of botanical realm. Lymphagogues are, basically botanical compounds that will promote the lymph system being patent and open and get lymphs to flow. The chief herb in that regard is Phytolacca americanus. It's poke. And so we make a poke oil that we use and we combine it with a few other herbs. You have, this, and you take it internally as well, and then you do it topically also. And you want to do, like topical poke oil with other things like cleavers and ceanothus, and you use a little bit of DMSO and maybe a little castor oil, but you put some heat on that over the areas where the main, kind of blockage is. And then what I was just talking about, the cabbage pole cyst, that's also really good for moving that lymph fluid also. And then, obviously you've got to have the, compression stockings. You can get the whole compression stocking goes up all the way so that you're really holding some of that pressure up. So it's not just falling down. That'll be helpful. One of the other things is that, I don't know, you didn't do radiation, it sounds like, right? I want to just make sure that radiation wasn't part of that. If it was just surgical resection of the lymph nodes, there are different approaches. And then there is, the lymph drainage massage, and there's some people that are really, really good at it and with it. There's also some acupuncturists that do really well also, and they'll even like let fluid out of the lower part of the body and help to drain some of that fluid out. It's a very specific skill set. You have to find the right people, and I can't refer you to anybody right now. I don't even know anybody doing that today. But there are, again, sometimes it's again like moxibustion, like I said, heat. You can do acupuncture. People say, oh, acupuncture not around lymph. It's like there's really I don't see any basis for that. Like you're not stabbing needles into the lymph ducts or something like that. It's not how it is. You're changing the flow of energy in the body. So that can be really helpful as well. Yeah, no, those are the main things I would do right now to try to address that without more information.
Very good. Very good. Well, let's get back to some juicy alternative cancer stuff, Dr. Miller.
Cool.
So someone gave me the book, The 1 Minute Cure, and I read it yesterday. Is there any merit to drinking diluted hydrogen peroxide in distilled water for cancer patients, either in remission or during active treatment? What say you about the 1 minute cure?
The 1 minute answer.
What's that? In a 1 minute answer?
Yeah. Well, I was going to say there's another question in here that was around hyperbaric oxygen, and kind of like whether that was, whether it killed cancer cells. I can't see at the moment here. I know, but
oh yeah, it was. What do you think of hyperbaric oxygen therapy to kill off cancer and or cancer stem cells? Was that question? Yeah.
Well, I don't think of hyperbaric oxygen as a way to kill cells. I do think of it as a way to increase oxygenation of tissues. That's what it does. when you increase the pressure above, 1.5 atmospheres, some of these different tanks you can go into can get up to like 2 atmospheres, which is basically just an atmosphere is the weight of the amount of air just piled on top of itself, like setting on your skin, like, it's like this is how much it weighs, all that air down to your foot, so when you go into the tank, it just increases the pressure. So it pushes that into your body. So as you're breathing and everything, the oxygen concentration in your body goes up. So you increase the amount of available oxygen. And that's, as far as healing things goes, it's really helpful, like especially for neurological issues, because these are in low vascular areas, they have a hard time getting oxygen to these areas. You need oxygen to run all of our systems, all of our, we're doing business in an oxygen rich environment. That's what we are. All of our ATP generation is, we make it from oxygen. So when you increase oxygen, you increase the capacity of the body to do a lot of different really important things, including run the immune system, repair nerves, et cetera. And if you combine it with other treatments, if you're doing other treatments, it can be a nice synergist. It can really help those things work better. But I don't think of hyperbaric oxygen as a way to kill cancer cells. I don't think to me, that doesn't make physiological sense, and I've never seen it do that. As we jump over to hydrogen peroxide, H2O2, it is another strong oxidative therapy and an oxidative substance, right? We make peroxide radicals every time that we generate ATP. Inside the mitochondria, we take sugar, we take fatty acids, we make this acetocoenzyme A, and we run our energy system, we generate ATP, and in doing that, we make peroxide radicals that then we quench with glutathione, right? At the source of it, we actually make superoxide, which is this very strong oxidant, but we quench it with superoxide dismutase, SOD, like the first layer of insulation, and then the second layer is the glutathione and the peroxide. So we are very familiar with peroxides. In the thyroid, we make thyroid peroxidase, right? You can measure it, TPO, and then we make TPO antibodies against that if there's too much of it. But the point being that we're very familiar with peroxides in our body, and it has a role to play. And it's another way to oxygenate the system. You're bringing more oxygen availability. And so it becomes what's called an oxidative strategy. And oxidative strategies are strategies that are based in creating oxidative damage in cancer cells. And so the metabolic phenotype of any given cancer is variable, and you can look it up. You can just go online, go on PubMed, or just go on Google, just go say, metabolic phenotype of ovarian cancer, and you'll get some information about what is it more glycolytic? Is it more vascular? Is it more angiogenic? What does it tend to look like? How does it function? And then you can get an idea of what, which way to go. And that can be related to diet and other things too. It's a little bit of a, you need to have a little bit of a background oftentimes to figure that out, but I often do that. And so for cancers that are really glycolytic, that tend to make a lot of lactic acid, they tend to be, oftentimes they're driven by lots of hypoxia inducible factors. I'll just give you a quick little breakdown, right? So I talked about that tumor microenvironment. A lot of cancers are vascular webs. They're just like this complex web of blood vessels. Chinese medicine has always called it a coagulopathy. They called it blood stagnation. It's this idea that there's a lot of stagnant blood in this, congested area. And in this congested area, without as much blood flow, the blood that's there depletes its oxygen. And now you have a low oxygen environment. In that low oxygen environment, the hypoxia itself generates responses in the tumor microenvironment. The response that it generates is that it starts to ask the tumor to start to make growth factors, particularly vascular endothelial growth factor, that drives the angiogenesis, the generation of new blood vessels to connect to the existing network in the body to bring more oxygen resources into the tumor. So that process is part of tumor progression and growth, right? So when you're blocking that with, you can do things like soak up the lactic acid, use high doses of bicarbonates and watch the urine pH, keep everything tidy, look at the LDH in the blood, get that system under control. That's one way to push back against that process. H2O2 is going to bring, it creates an oxidative presence in the cancer. And I like to combine it with other things. I don't generally just do H2O2. The most common thing that I like to combine it with is artemisinin. And so putting H2O2, and again, it's, you use the 3%, 3.5%, hydrogen peroxide, food grade, and you can always, you don't want to just take it straight by mouth. You can put it into water. You can mix it in with other things. you can, take it. And there's, like maybe it's 10 drops, maybe it's 15 drops. People have done different things where they'll increase their dose over time. But there is a little oxidative stress on the stomach too. It can be, for the gastric lining, it can be a little too much. It can actually be kind of burning there. So you have to, dose it just right. But it is a helpful strategy, and it will create more oxidative stress in a situation where you want to do that. Combining with vitamin A, combining with iodine, combining it with like I said, like with artemisinin and vitamin C in high doses. These are all kind of strategies to kind of bring in more oxidative stress to the cancer cells specifically.
I just wanted you to tell me that that hydrogen peroxide was gonna cure my cancer, Dr. Miller. That was too complicated.
Darn it.
No, no,
Oh,
that was great. A great blending of quote unquote alternative cancer stuff with deep molecular cancer biology explanation. Yeah, that was awesome. I want to see if you have anything to add based on this. My 5-year-old is undergoing traditional, which I take to mean conventional B cell ALL treatment. Been reflecting lately on how oxygen/breathing has been a challenge her whole life. She was born premature due to not getting enough oxygen from a short umbilical cord. Been a mouth breather, has Down syndrome, chronic runny nose causing breathing issues, sleep apnea, central sleep apnea, and now the ALL, which I think is partially due to hypoxia. From a Chinese medicine standpoint, are there specific deficits that could weave all of these things together, like a lung oxygen weakness or deficiency that could be showing up over and over in all these different ways? And if so, what would you call it? And where would you start going to look into addressing it? Very, yeah, interesting. I mean, and again, this is obviously that was a lot, and certainly would need to be your patient to really dive into all that stuff. But I just thought the how do all these things weave together, talking about oxygen, hypoxia, so on and so forth. And like I said, you did already give us a lot on oxygen and hypoxia there, but I thought it was interesting timing the question along with your answer. I don't know if you have anything to add to what you already said there.
It's interesting that you get back to the history, right, where you started with premature. She wasn't getting enough oxygen from the short umbilical cord, and so she needed to be birthed sooner than she would have, right? So not getting to full development. And with Down syndrome, there's oftentimes, folic acid can be a big player in that also early on. That's one pathway to think about too. Chronic runny nose causing breathing issues, right? Sleep apnea, and I don't know if you looked at it, but is there organic change here? Does she have a change in the actual structure of her sinuses, deviated septum, or anything else that might be causing some of the blockage? It sounds like also with this, like the night apnea, not getting enough oxygen. We could think about it in terms of lung, right? And we always think about the lung oxygen network as being the place where we deal with oxygen the most. But really, like the energy for the lung is coming from the digestive system and from the spleen and from this network that builds the qi, right? The energy in the body to support what the lungs do. And in the Chinese medicine perspective, the lungs are more the out breath. Lung is metal element, and the metal element is all about this release. It's about like the letting go. It's the animal self. It's metal. It's like what we actually release at the end of our life. It's considered like the animal spirit. It's very close to mortality. So it's the out breath and the grief and the loss, and that's what the lungs represent more than the kidneys, which the water element. The kidneys actually anchor the breath. It's the kidneys. And when you think about a premature child, it's the kidneys that are developing in that first early phase, but in pre coming into the world, and then through to the first year and a half, it's the kidney essence adrenal network that's building, and that's it's time for stability and growth, and that's our essence. That's that source of making us every day. And someone with like a essence deficiency could have it manifest in a lot of different areas, but not being able to capture the air, the breath all the way down is part of that. And then, so thinking about the kidney and the kidney essence and supporting that in this patient for sure is very important. And then the digestive system, like when the mouth opens at night, a lot of times apnea is like this it's like falling back, and it's like a dropping of the muscles, and that's that lift of the spleen energy. The digestive system is what giving that lift to hold everything together. And when that gets weak, we start to like lose that ability to stay together. Things start to fall open, and we get, apnea, snoring, and stuff like that. So there's lots of different pieces to this to kind of like think about when you look at it. And you said histamine too, right? I think that the paleo type diet is really good. I would get some nice bone broth too, is really important in when I'm conceiving here for her too. And I would say, somebody just said, hey, isn't collagen rich in bone broth and that causes cancer? I'm like, no, collagen we need collagen. We have to have it. We don't want to take a ton of it in a case where you're not doing any active treatment or something like that, because you could create a surplus. You could create a surplus of anything. That could be, but getting bone broth into the body with collagen and letting the body absorb that as a very assimilable, like soup base and things like that, that is a strengthening strategy, and use it with other things, herbs and everything else. But I would definitely dig in on this one and, try to get into this, deeper tonification of the kidney essence adrenal network, and support the spleen and the chi there and the energy, and get that system strengthened. That's where I would start anyway.
I love it. Let's bring it back to something a little more simple. Well, actually, none of these questions are simple. This question isn't simple. It's a simple question, but you can go a lot of different ways with it, like everything. Regarding prebiotics and probiotics, which brands do you trust? Which leads me to say, do you even do prebiotics and probiotics, or probiotics in particular? And what are your thoughts on?
What do you do? What's your thoughts on it?
There is, I saw this is going to get into alternative conspiracy land, but it's actually not. I saw a very compelling, it was like a little mini presentation post on Instagram about, of course I saw it on Instagram, right? About how, Bill Gates is now investing in probiotic companies and using gene edit. It's not even like conspiracy. He's made these public statements about how he's doing this, and trying to work his gene editing stuff into probiotics, for everything from soil amendments to kombucha starters to probiotic capsule companies. So until I can figure out which companies are in those tentacles and which companies aren't, I'm staying away from probiotic product. That being said, there are a couple like my friend Phoenix Aurelius makes his own, just his own brew from, it's not from any like company or anything like that. Cause you dig into these a lot of these you think it's all like hundreds of different companies out there, but they're all getting their probiotics from like the same 4 or 5 big mega manufacturers. A lot of them are, and those mega manufacturers are the ones that our friend Bill is investing in. So, but yeah, there are a couple. There's another optimally organic company that makes same sort of thing. They ferment a bunch of herbs and stuff in a box underground for a few years or something like that. And I like that one. We make our own sauerkraut, that sort of thing. The gene editing inside of probiotic bacteria thing has been weirding me out for
That's
probiotics
scary,
lately.
man. I don't like that at all. I don't like hearing that. I'm not a big gene editing fan. I just feel like we don't, you know what I mean? Like we're talking about this out of control thing, the uncontrolled growth, uncontrolled, like we're just not in a place where wisdom is guiding our decision making. And so I get really concerned about like digging into the edges of what's real and possible in the world, and pushing against those edges and creating who knows what, a Franken whatever out of everything. And I'm just not into it. And I'll say that I think that you're right. The fermented foods are really a great place to go, really good, like raw yogurt, yogurt cultures, getting good starter cultures. I was checking out this company called Bravo. They make the Bravo yogurt. It's like 300 strains. You bring the culture and you culture your own yogurt, right? And you create it at home. It's like, that's live, that's live food. And that's really important. I was going to mention colostrum too. I really like colostrum, when it's obtained in a really humane, really well established place where we have organic, free range, type of animals, and you're getting colostrum. That source is really good. And a lot of folks going through treatment need deep nourishment. They need to be supported. And so it's like colostrum and sometimes the probiotics. And, I'd oftentimes use probiotics. There's a lot of good data on probiotics in, and really the microbiota being in a place where it's stable and strong for increasing immunotherapy efficacy, very important for immunotherapy. And it's also important with chemotherapy efficacy too. Chemotherapy doesn't work well if the microbiota is blown up. I also just learned about also the first ever FDA approved fecal microbiota pill. It's actually like they now have like a human waste bank that they're actually now letting people get pills that are like, made in a place where it's all safe. And you can get these pills if you have had C. diff and you've been treated and it's recurrent. You can get these, fecal microbiota transplant pills. Fecal microbiota transplants have been around. I mean, the first ones that are in record were 300 AD in China by a doctor there who did the first one with a patient and just, actually took stool from a healthy person and blended it up in the right kind of saline solution, and then, used a way, some kind of a tool to get it to the other person. But nowadays you can do it, turkey baster and blenders and stuff like that. You can make these things. Just there's a lot of testing that goes into it. Whatever whoever using the FMT, that wherever it's coming from, the fecal material has to be tested for all the communicable diseases, and on and on. The microbiota, they do deep analysis of the populations. So it can be intensive. I've had a lot of patients do it over the years with great success, actually, and so I really like that as a concept. I think that I talked a lot in the beginning of this about biodiversity, and the loss of biodiversity that we've found in our GI tracts has deeply, diminished our immunological capacity. And without that immunological capacity, imagine whether it's a targeted agent, it's a chemotherapy, it's an immunotherapy. If we're not able to take apart the thing once it's been broken open, it's not going to go away. We have to, our body still has to do the bulk of the work getting rid of this stuff. So we need to be healthy and strong. And I do like soil-based probiotics. I've used the Megaspore biotic. I like that product, but Designs for Health has the ProBiospore. I like the spore forming, kind of more the stuff that would occur in the soil, like when you lift up a carrot and there's a bunch of dirt on it and you just you knock it off, but there's still dirt on it, and then you eat it and you get those microbes. We need those guys, and that's more the stuff that I'm into. Unless you're going in for like some, like you're like someone's just completely deficient in Akkermansia. Maybe give them some Akkermansia. But I'll say one thing about probiotics. I don't think of them as like I take them in and then they go down into my gut and they settle colonies there, and now there's this new people in there, new microbes in there. I think of them as more like targeted antibiotics, where they're going into the lumen and they're competing for resources with the other populations that are there, and changing the relationship so that it shifts what's available, that shifts what things can and can't live there. But you're not like just supplanting your biofilms, is the cities of microbes, by bringing in some guys that you bring in through a capsule. I always do soil conditioner, change the terrain with herbs and diet, change the soil. And then if you want to bring in some competing positive things like Saccharomyces, Boulardii, for example, a really good symbiotic yeast that does a really nice job of competing in the gut. And then you've got things like the probiotics, like I said, like this, the spore-based stuff, the soil-based stuff, the Bravo stuff, fermented foods. And last piece, if people do have SIBO, be careful. The probiotics don't work for that one. You don't want to give rich things like that for SIBO. You want to be careful with that. You can move things along first, get things stable first.
Let's get a little weird with the time we have left, Dr. Miller. My friend Jonathan Otto has been out there banging the urotherapy drum lately.
Okay.
We had Dr. Ed Group on the call a while back. He's been all promoting urine therapy. Have you done any research into drinking your own pee and what the benefits might be there?
I'll tell you, the most in-depth research I did was I was 25. I was living in Olympia, Washington, and we were kind of, out in the woods, and just, it was like a time where I was just living kind of country style. And
that's the place where you drink your own pee, is Olympia, Washington, in the woods.
It's the water, and it's the water.
That's where I was living before I moved to Utah. Yeah.
Oh, nice. Yeah, that's where I met my wife, Cara. Yeah, up in Olympia. I was up at Evergreen. I'm a greener. But there was a child and mom came back from Mexico. They ended up having hepatitis A, and it just basically spread into our little community there. And I was like, well, you know what? I'd read something about it, urine therapy, about returning the antibodies through urine to, treat hepatitis. And I've been like, well, geez, I've never tried it before. I've heard of it. Let me give it a shot. So I did. So I took my urine, I took the middle third and I drank it, 3 times a day. Man, I had almost no symptoms. Like, I mean, the urine turned like orange, in the middle of it. But there was a couple days where my smell got really strong. But like, man, I just breezed through that. Like I was amazed. And ever since that, I've been like, wow, okay, that worked. There's something to that. And I really think that there probably is a lot more to it that we should know that we're afraid to know. I talked about fecal transplants, it's like, it's my poop. Oh, it's my pee. Oh, God,
Eating other people's poop and drinking your own pee. Yeah. Wild stuff.
Yeah, I mean, maybe there's I mean, go back to remember the Amanita muscaria, the old stories about the way that it was taken was that it would first be processed into the urine of, the devotees, and then they would be given from them to like the high spiritual master, so they could just take the purified stuff. The use of urine as a way to, transfer materials has been around for a long time. So
there you go.
Yeah.
You go. And yeah, I mean, you mentioned Dr. Brzezinski and his anti-neoplastone therapy earlier. I mean, I think he synthesizes that now, but originally he was extracting that from urine.
Uh-huh.
So
Not surprised.
just go straight to the source. Anyway, Dr. Miller, this has been a treat, an honor, and a pleasure as always.
You're the man, Ryan. We're like click and clack here. I love it.
Just two guys doing our thing.
I'm gonna write a little note here. It's really been an honor to be with you all here today. Thanks so much. And yeah, I want everybody to find what they need and find just a path that makes sense.